How do advanced imaging techniques differentiate osteosarcoma subtypes? Imagine trying to identify different types of trees just by looking at their leaves and bark. That's similar to how doctors use advanced imaging to tell osteosarcoma subtypes apart. Osteosarcoma is a primary bone cancer with various subtypes, each with unique features. Advanced imaging helps us see these differences clearly, guiding diagnosis and treatment. Starting with basic imaging, X-rays and computed tomography scans give us a look at bone destruction and new bone growth. For example, a classic osteosarcoma might show a sunburst pattern on X-ray, indicating aggressive bone formation. CORT scans provide detailed 3D images of the bone, highlighting mineralization and cortical involvement, which vary among subtypes. For instance, periosteal osteosarcoma, which arises on the bone surface, often shows dense ossification on CORT. Magnetic resonance imaging is crucial for understanding how the tumor extends into soft tissues and bone marrow. It offers detailed images of the tumor's size and relationship to nearby structures. Advanced MRI techniques add even more information. Diffusion-weighted imaging measures how water molecules move within tissue. Tumors like osteosarcoma tend to have densely packed cells, restricting water movement, which shows up as high signal on DWI and low values on apparent diffusion coefficient maps. This helps distinguish more aggressive subtypes from less aggressive or benign lesions. Dynamic contrast enhanced MRI is another powerful tool. It involves injecting contrast dye and watching how the tumor takes up the dye over time. Highly vascular, aggressive tumors show rapid and intense contrast uptake, helping differentiate subtypes like high-grade osteosarcoma from lower-grade forms. Perfusion MRI further measures blood flow within the tumor, providing clues about its biological behavior. Nuclear medicine imaging, such as bone scans and positron emission tomography scans, adds metabolic information. Bone scans detect areas of increased bone activity, useful for staging. PET scans, especially when combined with CORT or MRI, reveal how active the tumor is metabolically. More aggressive tumors tend to have higher metabolic activity, which can help identify the subtype and any metastases. Different osteosarcoma subtypes have characteristic imaging features. Conventional osteosarcoma appears as an intramedullary mass with cloud-like bone formation on X-ray and CORT. Telangiectatic osteosarcoma often shows cystic, blood-filled spaces with fluid levels on MRI, giving a distinctive appearance. Periosteal osteosarcoma, which grows on the bone surface, appears as dense, ossified tissue with low T to signal on MRI. Periosteal osteosarcoma shows a surface lesion with intermediate to high T to signal and variable mineralization. Small cell and low-grade central osteosarcomas tend to have subtler features, often requiring biopsy for confirmation. By combining these imaging techniques, doctors can better differentiate subtypes based on cellular density, vascularity, and tissue composition. For example, high cellularity tumors restrict water movement and show high DWI signals, while highly vascular tumors show rapid contrast uptake on DCE-MRI. This detailed picture helps in planning biopsies, choosing the right surgical approach, and tailoring chemotherapy. Emerging research is also exploring how molecular profiling, combined with imaging, can classify osteosarcoma into molecular subtypes, potentially leading to more personalized treatments. Imaging not only helps in diagnosis but also in monitoring how well treatment is working by observing changes in tumor cellularity and blood flow. In summary, advanced imaging techniques like CORT, MRI, DWI, DCE-MRI, and PET work together to reveal the structural, cellular, vascular, and metabolic features of osteosarcoma subtypes. These insights are vital for accurate diagnosis, effective treatment planning, and improving patient outcomes. Always remember, if you or someone you know is dealing with osteosarcoma, consulting a healthcare professional is essential for personalized care and the latest treatment options.